I wrote this book to make people realize that there is a time window where we need to act to make sure the advances in health technology are capitalized on before the existing institutions swallow up the potential for change and we are left with mediocrity again. Came up with the title for the book, Health Tech, Rebooting Society's Software, Hardware, and Mindset, struggling with what metaphor to use for the fact that we're not just trying here to introduce technology. It's more than that. And it's also important to distinguish between software and hardware because in healthcare, as in so much of technology these days, you need to be aware of the complexities of introducing physical hardware, which is so much more difficult, especially when you're thinking about global healthcare. Because devices that operate, on the edge, but still have to be connected to a system, take so much more to roll out and to implement and update. Lastly, there is a mindset shift that's needed much more than it is a technology implementation that's lacking. What we need to do, all of us and each participant in the healthcare system, is to realize that things need to be done differently, quite differently. And there was even the question in my mind and in many people's mind whether the entire healthcare system as it exists and the many different systems that exist in different countries should not just be completely abolished and we should start over. I ended up in the book with a more positive view that a reboot was the right metaphor. A reboot not only takes care in a computer sense of lingering problems, so you sort of get to start over and you can start your session over where a lot of the problems are sort of taken care of. But it is, of course, also the way you do it when you have installed new software. And in this case, have installed new mindsets and have changed very important parts of the system. And the point with the title of the book is that these reboots have to happen frequently, as one does with computers these days. It is not enough to make one change or tweak to the system. And there are continuous reboots necessary. And it's not just about the technology. We need to literally change our mindsets. Now, explaining all that obviously can't be done in the headline of a book, but that's the point. And health tech is just this beginning. And as with many things around technology, the proof of change does not stand and reside only in the technology. My message is that the sense of urgency to get healthcare right using health tech needs to be there for all actors. I think traditionally, innovators will always say that there is urgency for change. But in this case, the important thing is that even though there are a lot of innovations available, if we don't implement them soon, if we don't implement them now, I'm afraid that the system's opportunity and openness to change will close, and the window will close, so that we are again left with a mediocrity in the healthcare system.